स्टार्ट करू शकतो.
Yes. Hello friends.
सर एक मिनिट तुषार इंट्रोडक्शन कर. एक मिनिट सर.
ते दोन्ही कॉमन.
ओके मी हे करतो. व्हेरी गुड इव्हनिंग. गुड मॉर्निंग डॉक्टर. All the elements, thank you so much for joining for today's webinar. Our endeavor is to spread awareness about rabies, which is fatal but can be avoided once appropriately vaccinated. This is an initiative from Cadila through its innovation to serve the society and humankind. The topic of the webinar is dosage reduction strategy in rabies management, role of novel vaccine. Dear doctors, rabies is the world's first three-dose anti-rabies vaccine, and with great pride, we would like to inform you that rabies has successfully completed 1 year of launch. Within more than 14,000 animal bite victims being vaccinated, 100% compliance was recorded, and no case of ADRS was registered. With this, it is my honor to introduce to speaker today's webinar, Dr. Sachin Pandole sir, consultant physician, DNB Medicines. Uh, Now I would like to request to Dr. Sachin Pandole sir to initiate the talks, and later on we have question and answer session. All the participants drop their questions in the drop box, and we will read out of the all questions after presentation. So doctor, you can start now.
Hello friends. As the introduction given, today's topic is rabies vaccination. It's a new advances in new vaccines and the doses reduction strategy in rabies management. Role of the novel vaccines. So we have a new vaccine, which is a TH rabies, or what you can pronounce it as a TH rabies. So it's a Cadila innovation. So it's a three-dose vaccination. So what are the contents of the today's topics are? We will discuss upon rabies disease, animal bite incidences in India, epidemiology, evolution of a rabies vaccine, its challenges, unmet need. Okay, and we are going to introduce TH rabies, its technology, and the clinical studies of phase 2 and phase 3 trials. So, what is the rabies disease? This is a disease it spreads through a bite of a warm-blooded animal like jackals, like dogs, uh, cats, and even it can be transferred with a rat bite also. So it's 100% mortality. It causes 100% mortality, but it is 100% preventable disease also.
सचिन
So
सर,
it's a yeah
स्लाइड
yes.
शेअर करायची दिसत नाही.
स्लाइड मी नाही शेअर केली, तुम्ही करा ना प्लीज.
टेक सपोर्ट
यस सर.
वो स्लाइड शेयर कर लो ना सर.
सर आपकी तरफ से कर दीजिए ना सर, यहाँ से नहीं हो पाएगा.
ओके तुषार, तुषार, तुषार,
प्लीज
तुषार.
येस सर, ऐका ना प्लीज. जर तुम्हाला जर येत असेल तर प्लीज ऐका.
तुला मी सांगतो, डेस्कटॉपला ओपन कर फाईल आणि तिथं शेअर ऑप्शन असेल. हा शेअर झाली. नाही नाही, स्लाइड 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 शो कर.
स्लाइड सरांनीच होते काय?
डाउनलोड कर डेस्कटॉपला, डेस्कटॉपवरती ओपन कर आणि तिथून स्लाइड ओपन करते. सो
तर
डेस्कटॉपला ओपन कर. आणि शेअर कर. ठीक आहे, राहू दे. नसेल जमत तर सरांना मला कंटिन्यू करा. मी बघतो हे जाऊन पटकन.
प्लीज सर.
हा.
The actually rabies virus have a different type of antigens over it. So to create immunity of a rabies virus, we are going to target some antigens. So there are some proteins over the structure of rabies virus. There are some N protein, P protein, M protein, and G protein is there. So this TH rabies vaccine actually focuses on the creating immunity against the G protein. So epidemiology of the rabies is globally there are 59,000 deaths yearly, and in India we share a major share of these deaths. It's a 20,000 rabies deaths per year, and all out of these 20,000 deaths, 91% deaths are in rural areas. So as evolution of a rabies vaccine, we know in our childhood, people used to say, if you get bitten by a dog, then you have to take 14 injections and around umbilicus. So people get scared of that injections instead of that bite. So that vaccine was introduced in 1885. It was a live attenuated vaccine which have a spinal cord contents. So it was non-standardized, dried preparation, and up to 31 injections of increasing immunogenicity was given, means two injections every time. So almost for 14 days, we have to take the injections. But it had too many side effects because it had a neural content. So we can get a GBS and so many side effects of it, and compliance also, because so many people don't used to take a 14 injections. 14 is 14 almost double of it injections on over 14 days. So then comes the 1911 we have inactivated vaccines which contain minimal brain content, which brain is up to 10%. uh, Minimal neural content. So 14 injections of 0.5 ml daily it was given. Previously it was 31 injections. Then it's a 14 injection, 0.5 ml daily. Then comes a cell culture. So these are the inactivated vaccines, which uses the cell cultures of more than 2.5 IU. So it produces standardized immunogenicity, and these are the lyophilized vaccines. Uh, these vaccines have a 5 injections. Uh, 0.5 to 1 ml is the dose intramuscular, and the dose schedule is 0, 3, 7, 14, and 28. These are the doubling. Means you can remember 0, then 3, then 7, 7, 14, and 28. So current challenges of this vaccination schedule, which is widely available in government and private setups, is actually these are cell culture vaccines, and means if you give the doses beyond 3 doses, the compliance will be decreased. And in inactivated vaccines, means which were the previous schedule, so which was a more than 50 years technology. Uh, it has an inconsistency in potency, stability, and short supply. And it has a short adverse effects also, as we mentioned already. So current challenges, 4 injections, and the graph is showing the 4 injections and the compliance rate. It decreases uh, definitively after the 4 and 3rd injections. So the Cadila has given innovations. They have produced the vaccine with the help of virus-like proteins. So this is the first protein subunit vaccine, which is having a VLP platform technology. VLP is a vaccine-like protein. So this is the first vaccine which is having only 3 doses intramuscular regime, that is 0, 3, and 7. So better compliance is there. And so convenience and ready to use. We don't have to reconstitute. These are the wire injections already ready to use. Just use and throw it away. Then what is the VLP technology? VLP is, as we discussed, there are so many proteins over the structure of the rabies virus, out of which we are targeting G protein. Actually, it's very difficult to isolate the G protein. So using VLP technology, but Cadila Pharmaceuticals have purified and stabilized it by it's a very nice technology. So VLP like particles are the protein complexes exist as a neuroparticles. VLPs are similar to the antigens over the virus, but they don't cause the disease and they don't have a genomes. So they cannot replicate, but can mimic the similar viral antigenicity without being a pathogenic. So they are capable of inducing strong humoral and cellular immune response. So that's why the VLP vaccines like TH rabies having a very good results without side effects or a minimal side effects, we can say. So what is the VLP technology as we already discussed? So what are the clinical studies of a phase 3? So we have discussed the phase 3 study of this rabies vaccine. It shows the safety and immunogenicity of this novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as a simulated post-exposure immunization. It is a randomized comparative control multi-center phase 3 trials. This phase 3 trial shows is actually compared with the Rabipur vaccine. Rabipur is 5 days regime widely available, and we compared the results of this 3-dose regime of TH rabies with the Rabipur. So we had 800 subjects, and randomization was 2:1. So the study design and objective was to demonstrate non-inferiority of the test vaccine to the comparator. Comparator is 5-dose regime Rabipur. And the primary objective was the subject with seroprotection at 14 days post first dose. Seroprotection is RNA virus antibody titer is more than 0.5 international unit per ml. And the secondary objective was subjects with a seroprotection at 42 days post exposure of first dose of a test vaccine, safety by monitoring subjects with adverse events. Means in this study, we have compared the efficacy as well as the side effects also or adverse reactions. And the results were consistent across different age groups. The results were consistent with different age groups and genders. The randomization were there, and they were similar across the all age groups and even genders. And the observed difference is 1.52% with a pre-specified margin. So it shows the non-inferiority for a seroprotection. And primary endpoint of the day 14 and day 42 were met. Test and comparator were identical in seroprotection rate, both on days 14 and on day 42. So study conclusion was TH rabies was non-inferior to the reference vaccine. It has a less adverse effects compared to the referral vaccine, and novel 3-dose TH rabies was found to be safe and immunogenic as comparable to the 5-dose of the WHO pre-qualified vaccine, that is, we call it as a Rabipur. And so this TH rabies have got some awards also. It got award of the Pharma Innovation of the Year by Economic Times. And it has also got the Golden Globe Tigers Award at Malaysia for Innovative Product of the Year. So this is all for this TH rabies and a new novel vaccine. Thank you. If you have any questions, you can ask.
अक्षय, वो क्वेश्चनरीज के लिंक पे जाके वहां पे कुछ क्वेश्चन आए क्या वो चेक कर ले. अक्षय,
No question, sir.
So if there
चेक
is
किया
no
वहां पे?
question, as there are no questions, we can conclude this session.
Thank you so much, doctor, for the information talk. We truly appreciate your efforts. As we discuss about Travis has won 2 prestigious awards in innovation category, IT India Pharma Awards and Golden Globe Tiger Awards. So thank you so much, doctor, for joining this webinar.
Thank you.
रेकॉर्ड कंपनी करून घेते ते
एक्सक्यूज मी सर,
हाँ सर.
मीटिंग एंड कर दूं?
Yes sir.
ओके, थैंक यू.
Thank you.